Medicaid shakeup: how CMS funding cuts impact behavioral health care. The recent changes announced by the Centers for Medicare and Medicaid Services, CMS, regarding the oversight of eligibility and workforce initiatives for Medicaid and the Children's Health Insurance Program, CHIP, could have significant repercussions for the behavioral health workforce. This shift is not just a minor adjustment, it represents a fundamental change in how these programs will operate moving forward. CMS has decided against extending the continuous enrollment guidelines that previously allowed certain individuals to remain enrolled in these programs, even if they were no longer eligible. This decision aims to prevent what they describe as unsustainable expenditures of taxpayer money. Moreover, the agency has indicated that it will not approve or extend existing Medicaid-funded workforce programs that were designed to enhance staffing in behavioral health, primary care, and home and community services. To date, these initiatives have collectively received a staggering $1 billion in federal funding across 5 states. Going forward, CMS will allow the currently approved programs to complete their duration but will only support new initiatives that can clearly demonstrate health benefits, cost savings, and robust accountability for federal spending. This is a significant pivot in strategy, as it reflects a broader effort by the Trump administration to combat waste, fraud, and abuse within these programs, ensuring that benefits are directed only to those who truly qualify. Dr. Mehmet Oz, the CMS administrator, emphasized this point, stating, "For too long, Medicaid and CHIP have drifted away from their core mission of providing a safety net for the truly vulnerable. That ends now." He assured that CMS is reinstating sensible regulations to ensure that Medicaid continues to serve as a vital resource for those who are eligible and in need of quality health care. As the largest payer for behavioral health and substance use treatment, these changes could lead to a reduction in funding for various initiatives aimed at supporting this patient demographic. Providers may find themselves losing financial support for programs they previously relied on, and individuals who benefited from continuous enrollment may suddenly find themselves without coverage. States will also face increased scrutiny to rectify any eligibility errors, or they risk losing federal funding altogether. Behavioral health providers catering to both youth and adult populations have been preparing for disruptions due to the significant cuts to Medicaid outlined in the recently passed One Big Beautiful Bill Act. This act has raised concerns about the future of funding for essential services. While CMS claims that these adjustments are designed to enhance the management of federal funds and improve the process for determining eligibility, the reality may be that fewer behavioral health workforce programs will be available. This could leave many recipients in a precarious position, scrambling to find coverage if they lose their current benefits. What do you think about these changes? Are they necessary to ensure the integrity of Medicaid and CHIP, or do they risk leaving vulnerable populations without the support they need? Share your thoughts in the comments below. CMS cuts $1 billion in Medicaid funding, impact on home and community-based care. CMS to eliminate Medicaid workforce initiatives for home and community-based services. In a significant policy shift, the Centers for Medicare and Medicaid Services, CMS, declared on Thursday that it will cease to approve funding for new Medicaid workforce initiatives aimed at enhancing home and community-based services. This decision marks a pivotal moment in the ongoing debate about the future of Medicaid and its role in supporting vulnerable populations. But here's where it gets controversial. CMS is not stopping at just workforce initiatives. It also plans to cut back on other Medicaid and Children's Health Insurance Program, CHIP, initiatives. This includes the elimination of continuous eligibility policies, which previously allowed individuals to stay enrolled in Medicaid for a designated period even if they no longer met the qualifications. The agency estimates that these rollbacks will lead to savings exceeding $1 billion. Dr. Mehmet Oz, the CMS administrator, emphasized the urgency of this change, stating, "For too long, Medicaid and CHIP have drifted away from their core mission of providing a safety net for the truly vulnerable. That ends now." CMS is restoring common-sense guardrails to Medicaid and CHIP, which will ensure that Medicaid remains a lifeline for those who are eligible and in need of quality health care. The original intent behind Medicaid workforce initiatives was to strengthen and build the workforce across various sectors, including primary care, behavioral health, dental services, and home and community-based services. These initiatives encompassed programs such as student loan repayment and workforce training, designed to attract and retain skilled professionals in these critical areas. While CMS will allow existing initiatives to continue until their completion, it has indicated that it does not foresee approving new Section 1115 waivers that would allocate funds for workforce initiatives in the future. Going forward, CMS is focused on supporting actions that demonstrate clear health benefits, cost savings, and strong accountability for federal spending, stated Drew Snyder, the Deputy Administrator and Director of CMS. This reflects a recalibrated approach that reinforces statutory boundaries, enhances oversight, and ensures taxpayer-funded benefits go only to those who meet eligibility requirements so that we can prioritize funding for our most vulnerable citizens. Staffing shortages have been a persistent issue in the home-based care sector for years, often leading to unfilled shifts and leaving individuals without essential services. This crisis has even forced some home-based care providers to halt their services entirely. As the population ages, the demand for care has surged, yet the workforce has not kept pace, resulting in lengthy waitlists and backlogs for services. Earlier this year, CMS also announced reductions to other programs funded through Section 1115 waivers that affect in-home care. In April, the agency revealed plans to discontinue funding for certain services that were previously covered by state Section 1115 demonstrations, including some non-medical in-home services. Kristen Palumbo, the Chief Operating Officer and Chief Compliance Officer of Innovative Health, commented on the funding cuts, stating, 1115 waivers have been a critical policy tool for states to design Medicaid programs that address the real-world needs of complex patient populations. These waivers allow for innovative approaches that reduce barriers to access and improve outcomes. Scaling back this flexibility would not only limit states' ability to respond to local needs, but also risk destabilizing care for those who rely on it most. What do you think about these changes? Are they necessary to ensure the sustainability of Medicaid, or do they risk leaving vulnerable populations without the support they need? Share your thoughts in the comments below. About the author. Morgan Gonzalez is an award-winning journalist and the associate editor of Home Healthcare News. She earned her bachelor's degree from the University of South Carolina and her master's from the University of Georgia. Her work has been featured in various reputable publications, including Behavioral Health Business, KFF Health News, Dallas Morning News, and U.S. News and World Report. Outside of her reporting duties, Morgan enjoys hiking, practicing yoga, and spending quality time with her cats, Ellen and Ocho.